Erectile dysfunction is defined as the inability to achieve or to maintain an erection satisfactory for sexual activity. So this is either patients who are not getting hard enough, or they're getting hard enough and they're not able to maintain the erection. It is a very common condition and is present in at least 50% of men over the age of 50 and up to 70% of men over the age of 70. Estimates are that around 30 million American men suffer from some form of erectile dysfunction. ED is caused by a variety of conditions. One of the main sources of erectile dysfunction is people who have vascular disease. This can be patients who have high blood pressure, diabetes, high cholesterol, patients who smoke, and patients who have other risk factors for cardiovascular disease. In addition, ED can be caused by a number of the treatments that we perform for prostate cancer, including radical prostatectomy and radiation therapy for the prostate. Patients who have neurologic conditions, including multiple sclerosis, poorly controlled diabetes, and patients with spinal cord injuries can also present with ED. In a minority of patients, this can be a psychologically driven cause, which can be due to performance anxiety. The diagnosis of ED is really based on the patient's complaint and how satisfactory they find their erection is for sexual activity. There are additional diagnostic tests that we can perform in order to check a patient's blood flow. These include penile Doppler ultrasounds, which are used to look to see what the blood flow to the penis is like in certain selected patients. In a number of cases, ED can be prevented. Patients who do have diabetes, patients who have high blood pressure, and who have other risk factors for cardiovascular disease need to work towards reversing those risk factors and can often prevent more severe ED from becoming a bigger issue. There are a number of benefits to seeing a specialist for ED. Number one, not all doctors are capable or have the knowledge set in order to provide all of the available treatment options for ED. Secondly, physicians who are specialists in ED are more often able to provide surgical services and have better surgical outcomes than other doctors who do not perform more frequent surgeries for erectile dysfunction complaints. Finally, a specialist who specializes in ED is going to be more comfortable talking about this and is going to make you feel more comfortable and will make this a more tangible experience for the patient who's presenting. There are a few different treatment options that we think about for erectile dysfunction. The most common are the pills that everybody has heard about. They include Viagra, Cialis, Levitra, as well as a number of other pills that are used on the market at this time. Other treatment options include intracavernous injections, which is a very small needle that the patient introduces directly into the penis about 5 to 10 minutes before sexual activity. In some patients, we think about a surgical device, a penile prosthesis that can be inserted, which serves as a gold standard for treatment for ED. Finally, we can think about treatments which include a vacuum erection device and an intraurethral suppository that can be inserted by the patient prior to sexual activity. Very often, determining which treatment is right for you is dependent on the conversation that we have. It's based on your other medical problems and the other things that you present with on your physical examination. Patients who have failed one form of treatment will often progress to other treatments. Patients who will put a priority in terms of spontaneity of sexual activity will consider other forms of treatment. And so this is a long conversation that we have together to figure out what is best for you specifically. Satisfaction rates with our treatments are variable, and they depend on patients' comorbidities or other medical problems, as well as what those patients' expectations are. Patients who do present and are able to use the pills have about a 70% satisfaction rate. Of those patients who fail pills and then move on to injectables, around 70 to 80% of those are happy. Patients who move forward with penile prosthesis surgery have around the 90 to 95% satisfaction rate. Those patients who undergo vacuum erection devices generally are not so happy. Long term, Patients who have more severe erectile dysfunction may find a loss of phallic length. In addition, patients who are not getting erections will have greater difficulty in achieving erections in the future and may no longer be able to use medical treatment options to achieve the erection.